So Rick, I'm going to turn to you now. We use this term social networks today. It's a new term for a very old concept, which is that there will be people in our lives who will introduce us to someone else, and that someone else may become a good friend, or may become our spouse, or may become a mentor. They're people who are connectors, and Mary was a connector. Maybe can you say something about that, or what you saw about that illustrates leadership?
I think that there was a fearlessness. I think Kitty kind of introduced that in her initial comments, that she was absolutely fearless in terms of crossing boundaries, whether it was crossing disciplines or cultural groups or class disparities. She had no limits in terms of, when she saw a problem. She had a unique way of being able to cobble together, in her mind, what she saw as the ingredients to that solution. So she believed, for example, that I think that, as healthcare leaders or people or leaders in nursing, you had to look beyond your field. You had to. It was part of your discipline to look beyond. Real leaders always transcended, were bigger than their training. You kind of use that as the pedestal from which you would act. But to have a real impact on the health of a nation, she clearly believed that you had to look at the inequities that led to those health disparities. She believed strongly that you had to, so that meant you had to talk to those people. You had to talk to people who had money, people who were in corporations, people who were, that they would, in this common sense notion she had, they were concerned about it too. So, the fact that she'd get turned down occasionally for, is kind of surprising, because she had this way of, as you said, she assumed you would be at dinner that night. Well, when she called you to ask for money, she assumed that you were concerned about this problem too. That was evident to anyone who had common sense and could see that we had generational problems. She was terribly concerned about the problems of children and families coming up in our communities today. That was a grave concern to her. And she thought for that, you couldn't just be within the field of healthcare, whatever. You had to have the chutzpah to move outside, to talk to funders, to talk to people in other disciplines, and certainly outside of academics. She certainly had no special, she didn't believe that researchers and people with PhDs could do it all. She really believed you had to have partners who were powerful. And she was fearless in crossing those boundaries. That's my sense. Again, one of the reasons I think she was such a natural interdisciplinarian. She in no way, she wasn't at all awkward talking across areas that she had little background in. She didn't matter. She assumed that you had a common concern, and that was enough to get started.
On this theme of leadership, the concern you share about the future, and Mary had expressed in public statements concerns about the generations that are being raised, as she called them, by the new orphans. In her speech, she mentioned the new orphans are the kids being raised by the television because the parents are not home, or they have no parents, or they're in foster care. And she talked about these kids being emotionally charged, and these patients will end up being patients one day. And are we ready to deal with this with this whole generation of mostly urban youth? But